Welcome back to Voices in Health and Wellness. This is the show where we hear directly from the innovators, clinicians, and thinkers driving the future of healthcare delivery. I'm your host, Dr. Andrew Greenland, and today we're diving into a topic that's increasingly shaping how clinics operate, what younger generations expect when it comes to care. My guest is Rotem Moshe, who plays a pivotal role at Stepstone Connect, a US-based organization focused on improving access to high-quality mental health services through telehealth. Stepstone works extensively with hard-to-reach populations and is part of a movement reshaping behavioral health. So Rotem, thank you so much for joining us this afternoon and welcome to the show.
Thank you for having me.
So perhaps you could share a little bit about your journey into mental health and telehealth and what led you into this space.
So I completed my master's degree in 2010 and started off my career working in substance abuse treatment. When the pandemic started, we had to quickly regroup and figure out how to deliver services while on lockdown. And up until then, I never even considered telehealth because we're taught early on in our careers that you would miss a lot of things virtually that you wouldn't miss in person. And quite frankly, it just wasn't a platform that any of us considered until we had to. And when the pandemic started, I started to really understand the benefits of it. From a research standpoint, there are a lot of benefits to telehealth. There's sometimes similar effects to in-person and telehealth. It offered convenience. It offered an expanded reach for clinicians. In 2021, I decided that I wanted to pursue a private practice. And as I was building my practice, I came across Stepstone Connect through a colleague that was involved with the program as well. And I've been with the company ever since. So I started with Stepstone in 2021, and today I'm the executive clinical director of the program. And it's just been an amazing journey. I've gone from being licensed in Florida, where I'm from, to being licensed in almost 9 states. And it's just been such a rewarding experience to be able to interact with people from different backgrounds, different walks of life, and not have any restrictions involved in terms of their access to me and my ability to support them.
Thank you. So you said you're executive clinical director at Stepstone. What does that look like day to day? What's a typical day for you, if there is such a thing, and how does it fit into the bigger picture of the organization?
Every day looks different. Every day looks different. As the executive clinical director, I focus a lot on programming, protocols, policies, and procedures. I work alongside a clinical supervisor that really does a lot of the legwork with overseeing the other clinicians. We all work together in an interdisciplinary team in order to provide the best possible quality of care, because there's a lot of challenges involved in telehealth. Given that we provide services to almost all 50 states, we need to make sure we really understand the resources available in the event of a crisis. There's very few, but when they happen, and we have to be prepared.
Thank you. And from your perspective, what's the biggest shift you're seeing in how younger generations, we're talking here about millennials and Gen Z, approach healthcare or therapy?
I find that they are more likely to participate in therapy if the access is easier for them. And there's a level of privacy in most situations that you can have at home, as opposed to, we work a lot with first responders. So there is also that fear and stigma of being seen in public, going into a therapist's office and things like that. So it kind of takes away some of the discomfort involved in seeking out therapeutic services, and the flexibility. So if one of our responders is doing a night shift and there's a therapist at Stepstone that works evenings, then it's perfect. They have somebody that they can reach out to.
And what about how younger patients approaching this are different from older patients? Are you seeing a distinction between the different generations?
I think my older clients are reluctant at first because of the technology piece. Are they going to be able to navigate through it? And best practice with telehealth is for clients that are reluctant or afraid of using, a Zoom platform or something like that, is to give them a test run so they can see that it's not as overwhelming as they may think. And once they get into it, a few sessions in, they don't know how they did life without it. So I would say that's like the biggest point of contention with my older clients is, am I going to be able to navigate through the tech world?
And are there ways that you've had to adapt as a company to model or change your service delivery to align with these different expectations? Yes,
we've been exposed to many different challenges over the course of the business growing. We've had to navigate through finding effective ways to provide services to rural areas because sometimes the internet connection isn't that great, or they may not have the resources in order to have access to a computer, in which case we deliver a computer to them that they can use while they're getting treatment, and then they just send it back once they graduate from the program.
I mean, you talked about some of the main advantages of telehealth for this kind of work and a couple of the technical hitches or resistance around the technology for perhaps older people. But what about the actual relationship between the practitioner and the therapist? How does that kind of work out and compare with, face-to-face models versus, the telehealth thing? Is there something missing from the telehealth model?
I personally didn't really find much of a difference. Once telehealth became more widespread and more widely used, you almost forget that you're speaking through a screen. I developed the same rapport with my clients that I do in person. It's the same relationship, connection. I haven't found that many of my clients held back because of the telehealth platform. If they do, it's because, some underlying fears and anxieties about being in therapy in general, which we slowly work through.
And I guess technology has been around for years now, and it's like you said, it really kind of exploded through the pandemic. But does the research back all of this up in terms of, this being a model which is completely safe and sound and effective from a therapeutic standpoint?
There is a lot of research to support that the efficacy is there in a telehealth platform, but there's also a lot of other factors to consider. It's still the internet, so we have to always be mindful of using HIPAA compliant, encrypted platforms in order to avoid anybody accessing the platform that shouldn't be. There's a lot of that we have to be mindful of because there is potential for confidentiality breaches through unintentional, but we do our best to make sure that we are always up to date, always safeguarding our clients. Even in terms of correspondence with clients, we have an app, the HIPAA compliant secure app. That's where we guide our clients to reach out to us, and so far, so good. It's been really effective for us. A lot of legwork involved in protecting their privacy, but the resources are there.
And you mentioned earlier on about being able to respond to a crisis. I mean, how would that happen? You're operating in one state, somebody's having a crisis in another state. How does your organization kick in that sort of situation?
What we do is, first things first, whenever a client hops on a call, we confirm where they're located, just in case something comes up in session, or if they even just arrive to session presenting with some sort of crisis. And we have a running list of police departments, medical hospitals, providers, things like that in each of our clients' area so that we can quickly reference it. And, if I'm in the middle of a crisis call with a client, I will message one of my teammates, all right, this is where they're located. This is what's going on. Send somebody. And that way we eliminate, especially if it's a situation where there's suicidal ideation or plans and intent, we act very quickly.
So there's a fast response element to this. You're kind of all geared for these kind of eventualities, which sounds very, very good. In terms of clients choosing a provider to work with, I guess there are a number of the providers doing similar work to what you do. What's the role of reviews and social proof in terms of how people choose where they're going to go for this help?
A lot of the work we do is we network with a lot of residential programs. Stepstone Connect's program is an intensive outpatient program. So it's typically a step down from a residential level of care or inpatient level of care to us for continuity of care. And so we work a lot and network a lot with different programs around the country, make sure they're aware that that we are a resource to them and their clients. And we've found a lot of success in just making ourselves known and showing our faces. And even the other day, I was on a Zoom call with some responders in Utah to explain the program. So, it's a lot of networking, I would say.
Got it. And then the platform itself, so presumably the client and the therapist will connect through the platform. I guess it's a bit more sophisticated than the Zoom call that we're kind of doing at the moment. What else does the platform offer in terms of functionality to facilitate the interaction between the therapist and the client? Just giving our audience some idea of what this actually looks like.
So actually we do use Zoom. There are different plans through Zoom that a provider can use. We use the most sophisticated one that they have that has all the security features that we expect. We also have a secure scheduling platform that we use. And basically the clients can access the platform, select time, date, provider, and schedule themselves. Oftentimes though, when they come in for the assessment process of the intensive outpatient program, we'll get an idea of who would be the best fit just from the pre-screening process. And our admissions team will reach out to the individual provider and say, listen, we have a potential client coming in. We think that you'd be the best fit. And then we go from there into scheduling the first session with them.
Okay. And I guess we can't not have this conversation without discussing AI to some extent.
Yes.
And there's been lots of stories around where AI is being used for therapy in some guise. What's your take on that? Do you think where are we at the moment in terms of what you've probably heard in the media versus where do you think this might go, and what's your kind of take on it?
I'm at this point, I mean, I know that it's going to continue to develop and maybe I'll have a change of heart in the future. I'm reluctant to use AI. I think that there's a lot of potential for confidentiality breaches. I don't really know where a lot of the content comes from. I know there's a lot of providers that will bring AI into the appointment and it's listening in on the appointment. And I think that there's potential for losing a lot of meaningful conversation if the client knows that there's a device being used or software being used that's listening in on them. The efficacy of counseling is knowing that whatever is happening in the session is staying in the session and that the clinician is reliable and is invested in their experience and their privacy. Personally, I'm not ready to broach the AI phenomenon, but I know a lot of providers that are segueing into that.
Is there any technology you would like to see available to help you do your work? So if not AI in the service that you provide, is there any other technology that would smooth the work that you do in this space with Stepstone?
I would love to discover any software or program that helps streamline documentation. I think that the documentation process can be really overwhelming for clinicians because here in the States, we have to navigate through a lot of licensing and credentialing boards, the myriad of insurance companies and their expectations, and they vary from state to state. And in order to appease everybody, it essentially becomes like a massive, massive amount of paperwork that every clinician has to complete on every chart. If the universe can provide a way to make that piece more manageable, I think it would be helpful in giving clinicians the space to focus more on clients without being burdened or bogged down by paperwork.
And in terms of tracking your organization, in terms of how things are going, what are the things that you're most interested in looking at in a sort of a metric sense?
We make sure to send out self-report surveys and client satisfaction surveys on a regular basis. It's important for us to have data points in order to see whether the services we're providing is producing the results we're hoping for, whether it's feedback on group processes and facilitators, or the way they feel that their needs are being met in individual sessions. Even just clerical issues that we could do better with. We take a lot of measures in order to have those data points specifically and get feedback directly from the clients we serve.
Thank you. And what do you find is the biggest reason for clients disengaging or dropping out, particularly in the sort of the younger users?
In my experience, clients that are externally motivated are not likely to follow through long term. So if they are court ordered to go to treatment, or if their families are pressuring them to go to treatment, but they don't inherently want to or see the problem, there's a higher recidivism rate with those clients. For the most part, we mostly experience clients that are motivated to be there, maybe guarded at times, but they warm up to the idea with time. So the majority of the resistance would be with the clients that come in that don't really want to be there.
Got it. And in terms of your team, I guess you must have a fairly big team across the states, because obviously you're a multi-state organization. How have you had to sort of bring them on board? Because presumably some of them are working before COVID in a face-to-face environment. How have you had to bring them on this journey of transforming the consultation into a face-to-face to a remote consultation?
So we have an extensive interviewing process. Whenever we have a specific state that we're interested in, we make sure to focus and zero in on interviewing clinicians in that area. To be honest, a lot of clinicians are already fairly familiar with telehealth, so it hasn't been that complicated. However, just like any other workplace, we have to get to know the provider, and after like the initial hiring period, we kind of get a feel of, all right, this person is or is not a good fit for our population. But for the most part, they transition rather seamlessly to the telehealth world. We do extensive training in the beginning of when they're being onboarded, so that they understand what our process looks like, ethical considerations to take when working in this capacity, and how it differs from in person.
Because you do have a remote workforce by design. I just wonder what the challenges are of having that. You're not working in one building where you have your therapist in one place. How does it work from the point of view of already being spread out, not necessarily ever going to connect in person? How do you kind of keep that cohesion together with everybody and a kind of common goals in the way that you're trying to run your business?
A lot of communication. We stress communication in our organization, and we give every clinician the resources to do it with. We all have each other, like we have email, texting, phone numbers. We have regular Zoom meetings among the staff in order to assess where our clients are at, how our clinicians are doing, what's working well, what needs improvement. So yeah, it's a lot of discipline and communication, because you can't just pop your head into the therapist's office and ask the question on the spot.
You alluded a few moments ago to the insurance thing. So do you think regulation and reimbursement models is keeping up with the way that we need to be delivering care? I guess I know the answer to this, but I'd be very interested to hear your take on it.
I think that it could be better. I think that there's a lot of, it's becoming a little bit more rigid, which means that we have to get creative in how we advocate for our clients. I would say it's challenging overall, though.
And what are some of the bottlenecks with the whole insurance thing? And I asked the question because I've spoken to many clinics across a range of different niches in North America, and they're all saying roughly the same thing. I'm just curious to know what the real nitty gritty of the bottleneck is with the whole insurance model.
I think having to prove to their satisfaction that there's medical necessity for the client, especially if it's a client that has a history of multiple treatment episodes. A lot of the feedback that I get from insurance company is, well, nothing's working, so why should we cover this? Whereas they're not seeing the person as a person that has been through significant life challenges and traumas, and it may take more than 2 or even 3 episodes of care in order to implement change. And I think that's the biggest issue is I get that it's a business and they don't want to pay, but they're your customers and they're paying for a service.
Got it. So what do you think is the role of telehealth platforms over the next 5 to 10 years? Are we going to have a massive expansion in this kind of thing? Is the face-to-face model kind of dead in the water? Where do you think we're going?
I think that it's going to become a lot more widespread. I think that, or at least I hope that, there's opportunities to expand reach even further to other countries, and hopefully there will be options and options to be able to be a clinician in the States and work with someone overseas that happens to need my expertise and niche in order to get through the struggles that they're experiencing. Do I think that face-to-face will become obsolete? No, because there are still some people that prefer that face-to-face interaction and really just getting up and getting out of the house and having somewhere to go to meet with their therapist. But there are a lot of more and more clinicians that I'm seeing now that are working from home and doing the telehealth route.
And what are the plans for Stepstone over the next 6 to 12 months? Do you have any direction that you're looking to take the company in?
Our goal is to service all 50 states, to find providers in all 50 states. We have a lot of clinicians that are licensed in several states. We want to make ourselves available to, different needs and populations. Like I said, we have a special programming for first responders. So I would love to see that part of the program expand even further, and normalize mental health for first responders.
Amazing. And on that note, Rotem, thank you so much for your time this afternoon. Really interesting hearing about you, your work at Stepstone, your mission and the direction of travel going forward. It's been really interesting. Thank you so much.
Thank you so much for having me.